We'll now revert to the NDP with Ms. Martin for 13 minutes.
Thank you, Mr. Chair. Somebody mentioned the list of people on the drawing board, so to speak. Listed community members, doctors, involved community people. I wonder if we could be presented with the list of names that are on these redevelopment committees for each site for Waterford and North Sydney.
Mr. LaFlèche?
I was going to say, I think, Mark, do you have that info?
Mr. Lecoutier?
Yeah, I can provide that for you.
Perfect.
Yeah,
Thanks, Mark.
Absolutely.
Thank you. Going back to what Dr. Earle talked about, you know, the IV antibiotics, those types of things, and hopefully that there would be acute care services, even though we're losing emergency services. Will these clinics, or you've said that these clinics would include colonos, x-rays, blood work, dialysis, mental health, those types of things. So is the functional planning including the specifics that are required for staffing?
Mr. Day?
I feel very popular at this meeting. As I said, Tammy, and as we move through the functional process and the programming, so the announcement last June came out, said 9 to 12 months for functional programming. So we're moving that forward. And so, for instance, when we look at DI services in New Waterford, for instance, moving forward, so we've asked the clinical directors for that service and the managers who administer that service or provide administration to it. Where do you think the future needs to be for DI services in the Waterford? So X-ray, ultrasound, you know, what other things need to be there in the future? And what staffing model do you need to operationalize to provide that down the road? So that is being a consideration as we move forward through the functional plans. The actual departments are saying, this is what we want, or this is what we think we need to have in the future to provide appropriate services, and this is a staffing that we will need to operationalize to be able to manage that. And that we're doing that for all of our services. So we're doing that for DI, we're doing that for lab collections, we're doing that for physiotherapy, occupational therapy, public health, primary health care. We're doing it through, you know, when we look at our collaboratives, we're looking at for mental health and addictions. We're looking for all the services that we're providing. And so for in North Sydney, for instance, renal dialysis, I mentioned that earlier, is going from 8 to 12 chairs. So that's an increase of 50%. So how do we operationalize that? So that's part of the functional plan to say, well, we have X number of nurses now that provide care for 8 patients or for 8 chairs. In the future, we're going to have 12. This is what we're going to need for staffing for that. Endoscopy in North Sydney. You know, we're expanding endoscopy services on the north side. So that's one of the things that doesn't get mentioned a whole lot. So we currently have 1 room. We're increasing to 3, going to operate 2 on a regular basis. What's the staffing do we need for that to move that forward to make sure we can operationalize that and get that appropriate? So continuing care is another one. So all the services that we're doing and looking at, we are looking at how do we need to operationalize that, and so what are the staffing models for that? And we're not doing that in isolation. We're doing that with all the different members of all the different services, the managers, the directors, the senior directors, to make sure that, you know, we're not saying, well, this is what we want to do, but we haven't talked to the people over here and how they're going to run it. So we want to make sure that we're doing it all together, working together as a group and as one whole health authority. Thank you.
Ms. Martin.
Thank you, Mr. Chair. And I believe it was Mr. Jessam or Mr. Ward that talked about the timeline for around the fall when the announcements would come out about what's left to do. Initially, when the announcement was made in June, that would put us at about a year. So I wonder, is this an extension to what you initially thought, or, you know, 6 months to 9 months to a year? And will what Mickey just spoke of, will that be included in the final report?
Mr. Ward?
So earlier I spoke about the timeline for the master planning work, and I talked about the functional program and the master program work. So the master planning work, we had been focusing on a 12-month from the time of the announcement by the Premier. With this being such a complex project, we're looking now at probably late August, early September for the final document to be received. But what you'll notice is our most recent announcement with the regional is certainly part of the master planning work. So as projects become obvious that we can pull them away and start to make some announcements, then we'll go back to the government. We'll explain what we think is our next steps, and then we'll be asking if we could move forward on various phases. So, you know, the 2 community health centers with the long-term care, Those are projects. We also have the laundry in North Sydney. That's another project. We have the redevelopment, the remaining of the redevelopment of the regional. And then at the Glace Bay facility, we have the redevelopment of the Glace Bay. We have the expansion of the emergency department. So we're exploring all those individually, and as we start to see projects that are available prior to the master planning being finished, then we'll start to move forward with and ask government for permission to move forward on them.
Mr. Day.
Yeah. And Tammy, just to elaborate on kind of what I was talking about earlier about the services in the facility, when you think of what we're trying to do here, we're trying to do think of one-stop shopping. So one of the best descriptors I give for people, and the people on the team are probably tired of me talking about it, is the Walmart on Spar Road in Sydney. So that's your one-stop shop. You know, you go in, you get everything done. So what we're trying to do is provide the one-stop shopping for members of the community. So if you go to your primary care practitioner and they're in a collaborative practice, which is in the community health center, and they give you a requisition for blood work, you can just walk down the hall and get that blood work done. Whereas if currently now you go see your family physician and they're outside of the hospital, and you give you that requisition for blood work, you may be less likely to get that blood work done right away because it's another trip for you. So we're looking at trying to collaborate it all together and bring it all together. If you need mental health and addictions counseling, you can do that while going to see your primary care practitioner, while you get your blood work done, while you can go see continuing care for your mother who needs some continuing care supports in home. So what we're really trying to do is trying to provide, you know, one-stop shopping, make it easier for people. I know transportation is an issue that we've talked about. This will also help alleviate that because you won't need to make as many stops as you go forward because you can go to that one facility and get it all. And if your mother's in the long-term care facility and it's attached, that's another bonus as well. So we're really trying to improve things for New Waterford and North Sydney and make sure that people have the appropriate access to care that they need moving forward, not only now, but for my kids who live in the community 20, 25 years down the road.
Ms. Martin.
Thank you, Mr. Chair, and that's a good segue into my next question. And while I appreciate all of this information, and believe me that I do realize it's going to be wonderful, but I will continue to advocate for what we're doing now and for the lack of services that we have or don't have now, and the fact that people are dying now. But going forward with long-term care, you know, my opinion is that we can't make enough long-term care beds because that's part of the backlog and part of a huge issue why your loved one is in a home in Tanamagush and you live in Sydney. You know, and hopefully that at the end of the day, when we have all of these in place, that won't be the case anymore. But there's currently long-term care beds in New Waterford, North Sydney, and an ALC unit in Glace Bay. So of the new build, the announced beds that are expected, how many of them are actually new beds? Because we know that we already have those in place. So how many, truthfully, new beds are coming that we don't have between those three facilities already?
Mr. Day.
So, Tammy, if you know North Sydney has Tysalas, which has 22 beds. Then we also have 4 East, which has 14 beds as well. So it gives you a total of 36. We're adding 60 on the north side. The original announcement was for 48. That has since been increased to 60, which I think is a great addition. So it'll provide us, 24 new beds on that side based on those 2 units that are currently there. In New Waterford, we have the 24 beds in New Waterford Heights. So in addition to that, we're adding that 60 in that community. That gives us an additional 36 in that community, right? So that provides us some leeway also to help out with some of our ideas as moving and not trying to decant, patients that are tying up hospital beds, acute care beds, which are much more expensive. It gives us that opportunity to decant them into long-term care facilities where they need to be. And they can get the appropriate care and the appropriate level of care that they need. So we really are, the 48 announcement was fantastic in June. That has been increased to 60, which is only a greater benefit. Will allow us to offset what's currently in those 2 long-term care facilities in those hospitals, those community hospitals, and then allow us to decant other members who are also on a wait list in the community or also tying up an acute care bed, which goes back to the ER backlog as well. And it's all a bed flow issue, right? So ER gets tied up because we don't have acute inpatient beds because they're tied up with long-term care patients. that's one of the reasons. So if we can get those long-term care patients into a long-term care facility where they need to be, provide more appropriate care for them, it frees up acute care beds, which also gets our ER patients who are admitted and waiting in ER for an acute care bed, and gets them moved out of ER and up into a bed, more appropriate. So it basically provides a better flow and more appropriate care to patients all throughout the health system.
Ms. Martin.
Thank you, Mr. Chair. So does that mean then that there are 60 new beds, not anywhere yet, because we do know that there's ALC patients in 4 North in Glace Bay, so I don't know where they're going, but, and as well as how many that, we could canvass today that are in an acute care bed right now that's taking up a bed. So is it 60 new beds?
Mr. Day.
Yeah, so overall, so we have the 24 I talked about in Waterford, so that's in addition to what's currently on 4 North, on Tysalas and on 4 East, because that's 36. If you want to count the 4 North in from the Waterford, from Glace Bay as well, so you have 24 and 18. That gives you a 34, your 42 gives you another 18 there, so you're adding in those 20, depart from the Waterford and North Sydney. So that it still provides us enough of what other acute patients would be, or long-term care patients in acute beds, to offload that for sure. So, and that was one of the objectives, was making sure that we had that ability. I don't think you could provide all kinds of long-term care beds, and you could always find somebody to fulfill them. But we also need to provide other services to those members. If we can find enhanced community services and those sorts of things, as hopefully we'll identify as we move this forward, that may be additional supports that we can provide as well. So,
Ms. McClellan.
Just to confirm that with the 60 additional beds in Northside and North Sydney, it'd be a total of...
New Waterford.
I'm sorry, New Waterford, it'd be a total of 74 net new beds.
Mr. LaFleche.
I just want to point out, those figures are what's part of this project. So there may be other things done in CBRM or nearby which are not part of this project in terms of long-term care. So that's the minimum you would see.
Ms. Martin, 1 minute.
So to be clear then, we're not including those patients that are already in an acute care bed that should be in a long-term care bed in CBRM.
Mr. Day.
that's a hard number to calculate on a regular basis, because that number fluctuates so much.
For sure.
So currently, right now, as Brett alluded to earlier, the regional hospital bed situation is very good. At certain times of the season or part of the year, we do reach max capacity, and we are full at that point in time. But right now, we have very few ALC patients in the current facility, and there's been a lot of work done with that over the last number of years to try and reduce that number on a regular basis. So it's not as huge of a number as it used to be.
Thank you. Time's expired.